Thank you so much for tuning in to the 45th episode of the Psychology Is podcast. I am Nick Fortino. On this podcast, we have covered a wide variety of topics. Anything within the realm of psychology, is game for this podcast. But one of the focuses has been on critically examining the modern practices of psychiatry. And we've interviewed people such as Robert Whitaker and Joanna Moncrief and Peter Gutsche. And then, those are some of the very famous figures. We've also interviewed people such as Beverly Thompson and Kelly Brogan and Marilyn Wedge and Roger McFillin. And in all of these different conversations, we've discussed various aspects of modern psychiatry and psychiatric practices, as well as the history of psychology. And so it's my great honor to be joined today by Dr. Bruce Levine. Thank you for joining me, Bruce.
Great to be with you, Nick.
So thank you. I'm grateful that your publishing company sent me an advance copy of your newest book, which was just published a couple weeks prior to our filming this, A Profession Without Reason, The Crisis of Contemporary Psychiatry, Untangled and Solved by Spinoza, Freethinking, and Radical Enlightenment. I found this to be incredibly insightful, really a masterful synthesis of history and philosophy and just logic and critical thinking, and I had not studied the work of Baruch de Spinoza formally, outside of a couple of YouTube videos summarizing his work. I really never read anything directly from him and was not really familiar with his core philosophy. So I learned a lot in reading this book, and I have studied extensively and formally, the psychiatry side of things, the history of psychiatry and modern practices in psychiatry. But even still, having studied that extensively, you've taught me a lot about the history and the present day, as far as the status of psychiatry and the practices and the philosophies of psychiatry. And we are about to go in depth talking about some of what you write about in this book and, the general critique of modern psychiatry. So I thought we could start by discussing the issue of the credibility of psychiatry. And you've talked in various talks available on the internet, as well as in your book, about the loss of credibility in the field of psychiatry. And really, I think when people study the history of psychiatry, you see that it's really defined by crises of legitimacy. Many periods of time where people began to question the legitimacy of psychiatry. And it seems to me that we are yet again at this moment in time where we are questioning the legitimacy of the field of psychiatry. And in times past, that was inspired by barbaric treatments such as organ removal and frontal lobotomies. And now it's inspired by what is being the narratives that are being perpetuated about the objectivity of these diagnoses, about the alleged causes of these conditions, and perhaps above all, the treatment of these conditions with psychiatric drugs that are often prescribed for extremely long periods of time. So can you just, my question to you is, can you kind of paint the picture of why psychiatry, in your view, is losing or has lost credibility as a medical specialty?
Well, the first thing one of the starting points of the book is this contemporary crisis, as you were alluding to, of psychiatry. And I think it's real important for viewers, for listeners, to understand that what I'm about to say is not very radical. We'll get to some more radical stuff later, hopefully. But what I'm about to say are just people are what even establishment psychiatry, at least some of them who are at least moderately enlightened, are acknowledging. And three big areas that really make psychiatry would make any real critical thinker scratch their head. So one big area that now establishment psychiatry is acknowledging psychiatry is failing in is treatment outcomes. And so we're talking about, when I talk about establishment psychiatry, there is no more establishment psychiatry figure than Thomas Insel, who is the former director of the National Institute of Mental Health through 2015, longtime director. And back in 2011, he used terms like abysmal, bleak, looking at suicide rates, looking at disability rates, looking at morbidity rates. And this sort of opened it up for even the mainstream media like the New York Times to write in 2021, talk about how psychiatry and addiction, substance abuse, talking about anxiety, depression, everything, the more that there has been treatment, the worse the treatment outcomes. All right. So, correlation isn't necessarily causation, but that's something that people should be concerned about. And even establishment psychiatry is now addressing. How they're addressing it is a whole other issue. So we could get to that later. But the second issue that establishment psychiatry is finally addressing is the whole idea that their DSM, their diagnostic Bible, is invalid. And again, this was radical 20 years ago. Only your real more strong, sort of marginalized critics of psychiatry were talking about that this is a diagnostic instrument that lacks validity and lacks reliability. And so it was obvious in the 1970s when homosexuality was still a mental illness, and the only reason that it was abolished was not because the American Psychiatric Association, who publishes the DSM, finally did science on this. It was abolished because gay activists protested and they got rid of it, which immediately told a lot of society, this doesn't sound like science. I mean, you can't protest and get rid of cancer or diabetes. So it was clear in the 1970s that a lot of the DSM was highly political, highly cultural, not scientific. But psychiatry partnered up with drug companies and they got the world to sort of forget a lot of these things. But now, again, 2011, Thomas Insel again in 2013 said, like the NIMH now believes the DSM is invalid. And actually, he said, we're not going to fund research that uses DSM categories. It scared the heck out of the American Psychiatric Association because that's their big moneymaker. So we now know that. Other establishment psychiatry figures are also saying this is not a valid diagnostic instrument. Third area that establishment psychiatry is finally acknowledging is the whole chemical imbalance theory myth. All right, so by the 1990s, folks like I'm sure yourself and others who really studied the literature knew that the chemical imbalance theory of low levels of serotonin causing depression or high levels of dopamine causing schizophrenia had been disproven. There's a lot of research on that. We can talk about that later, exactly what they did. But the reality was that it was discarded. It was an interesting theory, was discarded. But of course, this chemical imbalance theory was highly useful for psychiatry and especially for drug companies to make it more comfortable for people to take these, especially these SSRI, Prozac, Paxil, Zoloft drugs that people were told this corrects their chemical imbalance. And so they didn't speak real loudly. And a lot of, to this day, I'm convinced a lot of psychiatrists and a lot of primary care doctors who are most responsible for prescribing these drugs do not even know this theory was discarded a long time ago. But again, here's another area where establishment psychiatry finally started to acknowledge this publicly, that they had discarded. 2011, a guy named Ronald Pies, who is insider establishment psychiatrist, chief editor emeritus of the Psychiatric Times, went out and said, literally used the term, calling the chemical imbalance theory of mental illness urban legend. And he said no well-informed psychiatrist has ever believed this. And now Insel again in his recent book that he came out with in 2022, Healing, he's talking about, psychiatry's moved on from this chemical imbalance theory. So right off the top, those are three gigantic areas that that psychiatry has pushed. That have been failures. Their treatment outcome failure, their diagnostic manual failure, their whole theory of mental illness failure. And there's many other areas that other more critical thinking people and more radical people can talk about, that why psychiatry should lose credibility. But the get-go, really one of the starting points of my book was people have to understand that even establishment psychiatry, at least people who are not completely in denial, like people who are like presidents of the American Psychiatric Association, even key members of establishment psychiatry are understanding those issues and psychiatry's deep problems with them.
Mm. I want to read two quotes related to what you just said. One of them you partially quoted already, which was Ronald Pye's quote, which the full part of it, and you include this in your book. In truth, he says, the chemical imbalance notion was always a kind of urban legend, never a theory seriously propounded by well-informed psychiatrists. The other quote I wanted to share that you shared in your book was by Alan Francis, who was the chair of the DSM-4 committee. And the DSM-4, for people who don't know, was published in 1994. We had the DSM-1 in 1952, DSM-2 in 1968, DSM-3 in 1980, DSM-4 in 1994, DSM-5 2013. And there were some revised editions along the way, but those were the major publications of this book. And the chair of the DSM-4 committee, Alan Francis, said, there is no definition of a mental disorder. It's bullshit. You can't define it. And then he goes on to talk about how, although it's bullshit, basically, we still need this bullshit. And I want to ask you about that in a moment. But I also wanted to say like two more things. One, that quote by Ronald Pye is about chemical imbalance theory being an urban legend. He's still, like you said, an establishment psychiatrist. And I was reading an interview between him and someone else, and I wanted to read some of what he said here and listen to your response to it. So he's talking about his criticism of Thomas Szasz, which many people know is one of the true godfathers of criticizing psychiatry. And he wrote the book, The Myth of Mental Illness. And so Ronald Pye's, furiously criticizes Szasz's work. But then he goes on to say the following. He says, I would distinguish between two quite different groups of critics, he quotes. There are, on one hand, sincere and well-intentioned critics of psychiatry, whose aim is to improve the profession's concepts, methods, ethics, and treatments. But then he says, on the other hand, there are critics whose hostile rhetoric is clearly aimed at discrediting psychiatry as a medical discipline. These critics, he says, fall under the rubric of anti-psychiatry, which he would define as that movement which denies the fundamental legitimacy of psychiatry as a medical specialty, etc. But essentially, the movement that denies the fundamental legitimacy of psychiatry is what he considers to be anti-psychiatry. Now, this leads me to the follow-up question I wanted to ask. We're talking about how psychiatry has lost its credibility in present day. But again, like I was saying, it has lost credibility many times throughout the past, when it included homosexuality in the DSM, when it, prior to the DSM, was doing those barbaric treatments that I mentioned. So my question is, how has it regained credibility all of those times? And what, like, I guess, how are they getting anyone to take them seriously?
Well, that's a great question. And the first answer is not through science. Okay. They gave up on that, I think, at least the people who understand science in psychiatry. And the way it has regained, I don't know that it's regained its credibility, but the way it's regained its authority is you have to look at the political chessboard. And so one major way that it's regained its authority, especially after the 1970s, when people were laughing at it, literally. I mean, you had One Flew Over the Cuckoo's Nest, winning the Oscars. So it was pretty mainstream. And, that to laugh at psychiatry, you had the Rosenhan studies showing that they couldn't reliably diagnose anybody. You had the issues about homosexuality being balanced by gay activists. You had one issue after another that it was a laughingstock. And so psychiatry, their only real choice to retain their authority was nothing scientific they were going to find, but it was if they partnered up with somebody who had a lot of clout. And so they went ahead and they partnered up with the big pharma, with drug companies, and they were proud of it. If you could, I have quotes in the book from the medical director of the American Psychiatric Association in the 90s saying we're proud of this partnership they have between drug companies and psychiatry, and trying to convince himself it was a no strings partnership. Well, it was a mutually symbiotic. It was a symbiotic relationship. Obviously, drug companies were going to make a ton of money, and more things were pathologized and more people were being drugged, and psychiatry was going to regain some authority and power through that. So that's only one piece on the political chessboard. The second piece on the political chessboard is that there were a lot of people in our kind of society, which is increasingly in many ways alienating and dehumanizing, who are going to be inconvenient. So you've got people out there who are not breaking any laws, but for example, in schools, you've got young people for many, many years at the turn of early 1900s. If a kid was a real smart kid and he didn't pay attention in school, people didn't care that much. In fact, their family might be happy. He could still work on the farm. They didn't have to worry about him going off to college. So, but nowadays, as the economy has changed and a lot of other things in society has changed, the idea of a person hating school and not paying attention to it is a terrifying thing for a lot of parents out there. So you've got a situation where that fear can be more easily exploited. So psychiatry exists, to deal with things that are inconvenient out there, whether it's a kid who's not paying attention in a boring school or somebody who's walking around the streets, not breaking any laws, but acting bizarrely in a business district where rich people live or something like that. And so you can't bring necessarily, they're not, you can't arrest them, but you can throw them in, you can force them in some other kind of incarceration. So psychiatry exists for that reason. Psychiatry also exists because a lot of other people in medicine don't know what the heck to do with certain populations. And so for them, they may not say this publicly, but psychiatry is a giant wastebasket that they throw a lot of their patients that they don't want to deal with. Okay. And then psychiatry also exists at the very highest levels among the ruling elite of our society, the powers to be, whatever you want to call it, who need to have some kind of diversion to explain why so many people are depressed, angry, hostile, enraged, suicidal, substance abusing. And if they do not want the people at the top of any hierarchy don't want the status quo to change because they're having a good time. They're at the top of the heap. And so they need to have some sort of individual defect theory. So way back in Spinoza's era, 350 years ago, you had the symbiotic relationship was between monarchy and clergy. And so clergy served the needs of monarchy to say, like, well, if you're having a hard time out there, you're not praying to God enough, you're going to the wrong church, or you're doing something. It was some other kind of individual defect, not the fact that you had no power. There were a small segment of society had all the power and all the money. And so today, the clergy has lost power, not completely, but psychiatry has taken over that role in a lot of ways. What the ruling class needs to have somebody who looks like they're scientific, who is saying, like, the reason why you're miserable, you're depressed, you're suicidal, you're going out there shooting up neighborhoods. There's some sort of individual defect. They don't care, the ruling class, whether it's a biochemical defect, or now Instill is switching this thing to an electrical circuit defect or a genetic defect. They don't care, as long as everybody can just say, like, well, the problem is we got to fix this individual defect. So there's other political reasons on the chessboard why something retains power that has absolutely nothing to do with science, truth, justice, or any of those things. And that's true in many spokes of the societal wheel, as you would know, Nick.
Yeah, that last one is particularly interesting because, you can easily imagine or look at either current or historical societies that have been deeply unjust and unfair and And living in that society would make anyone begin to exhibit behaviors that could be classified as a mental disorder. And if you explain that in terms of the fact that you're living in an unjust, unfair world where you're impoverished and subject to authoritative governments, then you start looking at dealing with that cause, addressing it by, doing whatever it takes, protesting or, causing some type of uprising. But if it's an individual defect theory, then you are attributing the cause of your own emotional struggles to something that is wrong with yourself.
That's the classic, I'm sorry to interrupt them, but the classic example that a lot of people who have been critics of psychiatry who've come to this same point that I have, they use is the whole idea of, in the 1850s, there was a Louisiana physician, a guy named Samuel Cartwright, who wanted to explain why slaves were running away from the plantation. Okay, and so he came up with this illness called drapetomania. I mean, they were suffering this mental illness that forced them to go to want to flee the plantation, and get to freedom. And so, of course, you can see that even, I would hope almost everybody in your audience would immediately understand what the political nature of that disease was, because from he was speaking to hit the ruling elite in the South there who wanted to maintain slavery, who wanted to believe these slaves were happy on the plantation and that it was all the way it should be. There was no injustice going on, and therefore anybody who was running away was not a courageous, freedom-loving human being, but somebody suffering from a mental illness. And so, in that sense, if you see that kind of situation and you think like, well, maybe some of that kind of stuff still has continued, but we don't only have drapetomania anymore. We have these other kinds of things.
Like attention deficit hyperactivity disorder.
Exactly.
Oppositional defiance disorder. And
Right.
What's so irksome about that is not only are you justifying maintaining the status quo, but you're also making people think that they are defective.
Yes.
A double wrong there. Well, I thought, as we continue talking here, the kind of general organization of the conversation, and I'm already feeling like we need a part 2. So who knows, maybe by the end of this, maybe I'll invite you to do a part 2 conversation, because you're just such a wealth of knowledge. And I can tell that this conversation can go in many directions, but in an attempt to keep it fairly organized and keep, something along the lines of like major bullet points, I thought we could generally look at the 4 big key terms that are important to understand when understanding everything we're talking about, which are the diagnosis, right? So what it means for it to be diagnosed with something, and how these conditions are conceived of, and then etiology, the apparent cause of the disorder, and what the different theories are on that, as you already talked about with the flimsy chemical imbalance theory. Then also the issue of prognosis, and then the issue of treatment. And I think, if those are our major bullet points, we can weave in the insights from your book and, what you think Spinoza might have to say about these issues, and et cetera. So let's talk a little bit more about diagnosis. We've mentioned the DSM, the Diagnostic Statistical Manual. This is a manual that has been criticized heavily, especially in its recent editions. But my question to you, so at this point, we've witnessed major diagnostic expansion. Every version of the DSM, there are additional entire disorders, and often with many of them, the criteria have loosened up so that it doesn't take as much anymore to be diagnosed with the same condition as it did in the prior manual.
Right.
So there's those issues, right? And then there's the issue of all of the subjectivity involved in interpreting an individual's behavior. And there's the fact that I think most people know, but if, it's important to acknowledge still, that a psychiatric diagnosis is made very differently than any other diagnosis in medicine. Those, if you want to know if you have COVID or not, you take a physical test, you spit into a tube, and it tells you objectively, whether you're positive or negative. And many, as far as I understand, medical conditions are diagnosed along those lines through objective instrumentation. And psychiatric diagnoses are made entirely differently. And there might be attempts to create somewhat valid, reliable questionnaires, but above all, it's a psychiatrist making a determination, looking at criteria that were determined by a committee of psychiatrists. And so my question to you, my specific question right now is, do you see any value to identifying profiles of behavior if we, and patterns of emotional difficulties, if we can manage to avoid pathologizing the individual, and if we can avoid making inaccurate explanations of the cause of their condition? Do you see any value to creating these profiles of behavior?
Wow, that's a huge question, and you kind of surprised me that that's where you're going to end up, and I want to get to that, but I want to kind of go back a little bit to what you're just this whole issue of diagnosis, because I think part of a big reason why I wrote this book was to try to make a lot of these issues more interesting, and that's why I use Spinoza and Radical Enlightenment and free thinking. And so one of the things that I wanted to have people get, and I think a lot of people understand, feel that these diagnoses, it's a lot of what psychiatric research is garbage in, garbage out. These are just all pseudoscientific notions. And I think the fun thing about Spinoza was that he spent a lot of energy, and people who were in the Spinoza fan club, from Albert Einstein to Hegel to zillions of other really well-known famous people, one of the things that was really sort of captivating about how much he cared about just getting to the essence of things, getting to the truth of things. And are you talking about something real? And so he had these different kinds of ways you get knowledge. And the first area of knowledge was unreliable. For Spinoza, it meant you'd come up with these inadequate ideas, confused, muddled, partially false, completely false notions, somewhat what we call invalidity today. It's close to that concept. And for him, in that category, how did you get, then what kind of knowledge did you use to get to these inadequate ideas, these invalid ideas? Well, you based it on opinions. You based it on anecdotal evidence. You based it on hearsay. You based it on your imagination. These were his categories. And so that was a kind of a fun thing for me to kind of get people to sort of like look at this whole issue of diagnoses in a fresh way. Like even somebody 350 years ago, Spinoza and all his buddies, his critical free thinking buddies, would have said, this is nonsense. How do these diagnoses come into being? They're somebody's opinion. And what we know is the American Psychiatric Association creates the DSM. It's a small committee at the American Psychiatric Association. They create it based on their opinions. And the more interesting question is like, well, how do they make these opinions? Based on what? And if you take a look at the history of how these things become diagnoses, certain behaviors and certain phenomena become, quote, mental illnesses, it's based on their perception of what gets them uptight, what causes tension for them, and what causes tension for other people. And you clearly see that with homosexuality. They assumed, as was the case in the 1940s, 1950s, homosexuality got a lot of people uptight. And they were way behind the curve in understanding by the late 1960s, a lot of America was not so uptight around folks who were homosexual. They had starting to have friends who were out there homosexuals, but they were behind the curve on that. And so they were still thinking that this was progressive to take, these people who were making everybody uptight, themselves included, and call them mentally ill versus calling them sinners or calling them criminal. Okay. And if you understand that, you see how that is the same way everything becomes a mental illness. So again, we were talking before about these ADHD, attention deficit hyperactivity disorder kids, or these oppositionally defiant disorder kids. They create havoc, a little bit of havoc in classrooms. If you've got 25, 30 kids, if you're a teacher and there's some kid who's not paying attention, who's not listening to everything you say, they're going to create tension. Okay. Now, in their opinion, being in that experience, that feels like, okay, is that a mental illness? So does that make any sense at all in a scientific sense, that a kid who doesn't create tension in a certain situation because they're having a good time, they're paying attention, they're behaving, but in other situations they create tension, like classrooms and maybe some families, Is that enough, for a psychiatrist, to establish that somebody has a mental illness? So I think once you really get to that, you realize, wow, from the get-go, we're talking about garbage here. And then it gets worse. So what are diagnoses? In a sense, they're opinions about opinions. And that's where you move into reliability issues. So not only are these mental illnesses based on opinions which are just invalid scientifically, you can't trust that. But also, even if you believe, for the sake of argument, that ADHD is a disease, you say, wrong, Nick, wrong, Bruce, that's a disease. Well, we know, you and I know, that you can't reliably diagnose that because, it's based on all these non-objective measures. It's usually diagnosed on these paper and pencil questionnaires that are given to teachers, given to parents, and they're notoriously unreliable, which by that I mean that different people, different doctors, different teachers will look at the same kid and come up with different ideas. And so in all of these diagnoses, even these so-called serious mental illnesses like quote schizophrenia, that the reliability among people diagnosing these people is incredibly low. So you have a situation where it's been long known that these concepts are invalid scientifically and unreliable. In science, that means it's garbage. We shouldn't even be talking about these things. The idea of trying to associate these things with genetics, with brain chemistry, with parts of your brain, it's ridiculous, okay? It should have been, from the get-go. So it's an important thing, when guys like Ronald Pies talk about like he would call me an anti-psychiatrist for saying something like that. Even Thomas Suss was not engaged in this. He actually, as I talk about in the book, he said, look, I'm no more anti-psychiatrist than I am anti-Christianity or anti-Semitic. It's just, if you want to believe that stuff, go ahead and believe it. But it's not science. It has nothing to do with real medicine. Okay. And so, for a guy like Pies, I guess that makes me an anti-psychiatrist. For me, I'm people want to go to psychiatrists and they want to believe in their medication and they don't understand placebo effects and they want to use them. It's like consensual adults should do what they want. But, the idea of guys like him trying to convince me there's anything scientific about psychiatry is ridiculous, because from the get-go, their building blocks, their diagnoses themselves they have zero scientific value. Okay. So again, I know I'm repeating myself, but it's important for people to understand once you reach that point, everything else is garbage. It's garbage. And you're going to do research with garbage. You're going to come up with garbage.
Yeah, well, thank you, for your indignance, for your passion. I think it's merited completely. And one of the very interesting things that I have observed is the way that a diagnosis can kind of become a self-fulfilling prophecy. In that, for example, as a psychology professor for 7 years now, teaching classes of 50, 60 people, multiple classes of that every semester. I've witnessed so many people, right? I've come across thousands of people at this point, and so many of them have, let me know that they have ADHD. And when I listen to the way they talk about it and the way that it has become absorbed into their identity, I see the way that it's the excuse for any time they're distracted. And it is the excuse for never working on developing the skill of concentration. Now, with total, respect to anyone listening who has been diagnosed with that, who genuinely struggles with paying attention, I'm not saying that you're just lazy. I am saying, though, that it's kind of like the equivalent of, let's say you had like a really scrawny 12-year-old boy, and a doctor said, you're scrawny, that's just your nature, you're just going to be scrawny, and implied that lifting weights wouldn't make this kid get bigger muscles, right? That's kind of, I think, what happens with something like ADHD. The implication is that's the nature of your brain, that's how your brain works, and so there's not really any chance of improving that. You just need drug treatment to help you. But in the same way that a scrawny 12-year-old can get, frankly, buff if he were to put in the work, a person with attentional issues can become a master meditator in 15 years if they were to put in the work. They can develop this skill. And it becomes, like I said, a self-fulfilling prophecy, because it's a belief now that you have about yourself that affects your behavior in a way that actually makes that belief become more true. Because again, it justifies your inattentiveness. It gives you an excuse, and it totally demotivates you to put in the work to develop the skill of concentration.
Well, a big thing that you're saying here is I was talking before about the political chessboard, and there's another component that you just put out there that I want to kind of talk a little bit about, which is that now the powers to be have figured out a way to put mental illnesses in there with identity politics. And they figured out a way to like convince folks that really there's only two choices. That you can either be viewing yourselves as lazy and immoral, or you have a mental illness. And what I always tell folks, when authoritarians give you two choices, take the third. And there is a third choice. But sadly, a lot of folks who like embrace their mental illness, whatever it is. I mean, I'm like you, young people show me these Tumblr accounts, not theirs, but they just want to let me know what's going on, and they show me that people identify with being bipolar, with being a borderline personality disorder, and that's their identity that they even put on their profiles. Is that what it tells me? And the young people I talk to agree with me on this. I haven't done a formal scientific study on this, but anecdotally, it's that these people believe that this is the only way that they're going to get any kind of compassion. That otherwise, if people who reject this, people who say the kind of stuff that there isn't a disease or disorder, the kind of things that we're talking about, are you saying therefore that that I'm lazy or immoral or something like that? And you made it very clear, and I make it clear all the time. That's not what we're saying here at all. But that's a hard message to get across when over and over and over again that people have been told there are only these two camps, and you have to pick one or the other. And that's a lot of what identity politics, a lot of that kind of stuff is going on in other areas as well. But it's one more problematic piece on the chessboard that makes overcoming and dealing with this whole psychiatry mess even more difficult.
That's a great point. Well, I guess to kind of come back to that initial question, what do you think about that? Like, is there any merit to developing profiles of problematic or difficult behavior?
I think that certainly people have different temperaments. Parents know that. You have a few kids, some kids are going to be more extroverted, some kids are going to be more introverted, some kids are going to care more about relationships, some kids going to be more mentalistic. So people have different temperaments. And I think really, if you want to help somebody as a teacher, parent, therapist, you really spend a lot of time being curious about what is their, what really rules them. What are the really important things and what are they most afraid of? What do they most care about? How that creates a certain kind of temperament. And so I think if you do that with the sense of like, nobody is mentally ill, nobody is mentally healthy, that we all have these temperaments, and that we can deteriorate. All of us have the possibility to deteriorate to our dark self, which could be being suicidal, homicidal, a drug abuser. And all of us have, our best self that anybody would want to be friends with. If you view these things, as you said, as a very non-pathological, non-medicalizing, and you understood like, yes, you have, there are all these kind of different ways of approaching life, different kind of cognitive constructs, different kind of things, different things that people focus on. If you view it that way, you're going to be a better helper. So, I mean, it's certainly not the case that there is this, people are all the same. And it's important if you're trying to help somebody to find out who they really are.
Yes. To the point you brought up too earlier and wrote about how, the role of creating tension for others. And like you said, the more tension that someone's condition creates, the more severe their mental disorder is considered to be. And that's no coincidence. and you brought up what I thought was brilliant, which was like the example of how you don't see something called submissive compliance disorder. Because if someone were submissive and compliant to an authority figure or something, that would cause zero tension whatsoever to an authority figure. But you could make an argument that that is just as legitimate as any other diagnosis in the DSM. You could easily create criteria for that. You could easily also point out negative consequences that could be the results of that. Like you, bro, you could have one parent who is submitting and tolerant of the other parent abusing the kids, right? And so, so wouldn't that be considered, a problematic behavior? But it's not, because it doesn't produce tension for any authority figures. And it kind of got me just on a thought experiment of like, what else could we just kind of almost as a satire, you could do like a satire book, a satire DSM, and just make up a bunch of stuff. And I guarantee you could make it sound just as legitimate as the real DSM. Like you could put FOMO disorder, fear of missing out disorder, right? And you could definitely list criteria. You could describe it in a way that people see themselves in it. You could think of like insatiable greed disorder. And, hopefully someone does this project, a satire DSM.
Well, it's funny for me, my age, when I walk around and I see just people talking out loud with nobody around them. And if you come up real close, you see maybe there's something in their ear, and they have that kind of a technology thing going. But my immediate reaction is like, oh, when I was growing up, that person would be, somebody would call the cops, and this person, they'd be carted off to the psychiatric hospital because they would be, quote, schizophrenic. They'd be hearing voices because they create a lot of tension. But nowadays, it's kind of humorous for me, like because of the technology, you could go around talking to yourself out loud all over the place, and you're not creating tension. People just assume like, well, yeah, you must be talking on the phone. So for the fun of it, sometimes I'll go around talking about like, preparing a speech and just going around a park and talking out loud. And, no one thinks anything of it, even though I don't have anything in my mouth. So, the other part of it, like less funny about this tension thing, which I flesh out in that book, is that not only the way an illness is created is how much tension it creates, and how much the more tension, the more serious it is. What also happens in our society that has nothing to do with science, but it's more having to do with just what people have been trained to think, is that if people have trained to think like, well, the more serious something is, certainly it must be a brain disease or a genetic disease. Now, there's no scientific reasons for all this stuff, but that's what goes on. So routinely, lots of people will say like, well, attention deficit hyperactivity disorder or oppositional defiance disorder, these kids are a handful, but they don't create that kind of enormous tension. So people are more willing to say that, well, maybe this stuff isn't a brain disease that's genetic. But if they see somebody who's walking around, with bizarre delusions, or they're people who are like talking incoherently, and they're really creating enormous tension, and somebody says, well, this person certainly has a brain disease and they're genetic, they're going to more go for that. So you have to understand, you have to then ask yourself, again, this is the fun thing about entering into the Spinozist universe. You become much more of a critical thinker. Is that legitimate? Just because something creates a lot of tension, does that make it a mental illness? Just because something creates a lot of tension, that makes it a serious mental illness? And just because something is like that, that means we have to accept the idea that it's a brain disease or genetic? Or can there be completely other explanations? All right. And I think the fun of getting into this, and I try to, for me, a lot of this stuff is fun. It's exciting, is to like really start using your brain again and really enjoy free thinking and critical thinking, because that's what Spinoza and all his buddies done. And that thread has gone throughout history. And unfortunately, today, with people getting more and more schooling, okay, they're less and less energized and inspired, from my point of view, to enjoy the pleasures. And it really is a pleasure, just like sexuality is a pleasure, a beautiful ocean and sunset are a pleasure to look at. Free thinking, okay, and critical thinking is a pleasure. Now, more pleasurable for some people than others, but it's certainly one of life's pleasures that you're not going to be able to enjoy if you're in like some psychiatric institution, whether you're psychiatrist or a patient. It just doesn't go on in these places. Okay, it's not. It doesn't exist. And so, just from the idea of like trying to revive people having some joy and pleasure and power in their life, I think it's like what I want to communicate. This stuff could be really fun to have these kind of dialogues like you and I are having right now, where we're just trying to get to truths of things and we're trying to bounce off ideas and we're just trying to, like I say, critically think, free think.
Yes, it is enjoyable. You offered the definition of a free thinker, I think according to like Webster's dictionary in your book, which is one who thinks freely or independently, one who forms opinions on the basis of reason independently of authority. And, as I learn more and more about Spinoza, I now understand that was a guiding light in his life, was to be a free thinker. And I understand that he, very courageously and boldly spoke out against the Jewish religion into which he was born and the claims of the Bible. And the Bible in that time period, and still today in many places, is considered an authority, a divine authority for that matter. And then you have the chapter in your book, I think it was called Two Bibles. So can you tell us, what would Spinoza have said about the commonalities between the Bible, the religious Bible, and the DSM?
Well, he would have said, for example, what he said, well, to start with what he taught, what we know what he said about the Bible, okay, in this, what we're talking about, the theological political treatise, which he wrote in 1670, which was 7 years before he died, and made him a pariah, made him a heretic, made him actually an object of surveillance, got him in deep trouble. Let's just put it that way. And what he said was that, look, this Bible is a work of people, men, okay? It's not the word of God. And he used terms like that were really strong in that era, calling it faulty, mutilated, adulterated, inconsistent, pretty radical terminology for the Bible in the 1600s. And the reason why he did this was that it wasn't like he was anti-Bible or anti-religion. In fact, he was hopeful. He believed that, for the non-philosophical, the non-rational, if they got the message from the Bible, which of one of justice and charity, which is not the only message of the Bible, unfortunately, but it's part of the message of the Bible. He was all for that. He believed in justice and charity, and if that's how if people got it from the Bible, great. But it wasn't a philosophical, scientific piece of literature. It was a moral narrative written by people for a bunch of political reasons. And what his concern was for his buddies and himself, they were free thinkers, that if you believed that the Bible was the word of God, okay, and then the people who were setting themselves up in that society as the best interpreters of the Bible were the clergy, the ecclesiastic authorities, then you see how the game works, they were going to have the most power, and they were going to have the most power to shut up people like Spinoza and his buddies. And what he cared most about was freedom of speech, freedom of the ability to express yourself, freedom to be who you are. And he cared a lot about having freedom from these ecclesiastic authorities, these monarchs, and, freedom from all kinds of places. We can get to more of the more interesting aspects of what he cared about in terms of freedom. But so when you bring that to the Bible, and so we know what Spinoza, how he felt about the Bible. And when you get to the DSM, which is ironically, it was kind of fun for me, because to write that chapter, the Two Bibles, was kind of fun because we call the DSM, inside and outside of psychiatry, psychiatry's Bible. And so it's not too difficult to guess what Spinoza would have thought about the DSM. He would have said, like, well, at least psychiatry is not saying it's the word of God. They're at least admitting it's the work of people. And he would feel sorry for these psychiatrists who would try to, view themselves as scientific, because clearly, as I was saying before, these are just notions based on opinion, no different than these clergy's notions of what's sin and what's not sin, and what you're going to go to hell for and what you're going to go to heaven. So he would see that. He would see it as a moral narrative. He would also see You know, he was astutely, Spinoza was is an interesting guy because not only was a traditional philosopher in terms of caring about metaphysics, epistemology, but he cared about psychology. He also cared about politics and religion. And so he would immediately see the power game of, like, again, once again, we have a situation where some professional class, not clergy, but these psychiatrists and these mental health professionals who are declaring themselves the superior people to interpret this scientific instrument. And so nowadays, what has more authority is science rather than divinity. And so if you can set yourself up as scientific authority, when we know the Bible is pseudoscience, I mean, the DSM is pseudoscience, then you see how that game works. And so that would be important for a guy like Spinoza, if you see the parallel, is to show that the DSM was pseudoscientific, to strip their professional interpreters of the power that they have over other people. So I think I feel pretty safe in saying that this would be a pretty clear kind of thing that would happen for a guy like Spinoza and his friends, some of whom were even more bold and outrageous radical free thinkers and got themselves thrown in prison. Spinoza sort of lucked out, you know, in a lot of ways. They didn't get thrown in prison, didn't get assassinated, but some of his friends were not so lucky. And so that's what would clearly be the case, that anything where somebody was imposing their opinion as truth and using that to oppress other people would be abhorrent to Spinoza and his buddies.
Mm. Mm. Yeah. You know, it's interesting. Like, I'll read a little bit more. I wrote down a quote that you wrote. What makes a free thinker is not his beliefs, but the way in which he holds them. That line in itself is important. It's not his beliefs exactly, but the way in which he holds them. Forgive me if I'm misattributing this to you when it was actually Spinoza. I only wrote it in
No,
quote.
this one is a Bertrand Russell from The Value of Free Thought.
Thank you. Thank you. Bertrand Russell. That's right, because I went ahead and got that PDF and planned to read it. So this is Bertrand Russell. Thank you. So what makes a free thinker is not his beliefs, but the way in which he holds them. If he holds them because his elders told him they were true when he was young, or if he holds them because if he did not, he would be unhappy, his thought is not free. But if he holds them because after careful thought, he finds a balance of evidence in their favor, then his thought is free, however odd his conclusions may be. And I really love that quote because, and partly because I think that when people hear that definition of free thinker that I read off a few minutes ago of, you know, one who thinks freely and independently, and one who forms opinions on the basis of reason independently of authority, I think there are some people who kind of think they're engaging in free thinking only because they're going against the authority. An example of this could be people who believe the earth is flat. I think often they identify themselves as like the freest of thinkers because they are, you know, bucking this notion that the earth is spherical. And that to me is not exactly free thinking. And I don't think Bertrand Russell would think it was either. Like he said, you have to, after careful thought, find a balance of evidence in their favor for those ideas. But anyway, it's like it's like if you have a belief that is mainstream on whatever topic, like that the earth is spherical, that doesn't mean that you're not a free thinker just because you believe what most people believe. Again, it's not what you believe, it's how you form your beliefs and the way in which you hold them. So I just thought that was like an important thing to highlight.
Right. No, it's real important. Yeah, what you're talking about, there's people who are just contrarians, and I think that they're free thinkers. And that's what's really interesting. A guy like Bertrand Russell, part of why he loved Spinoza, although he didn't agree with him. And I have to say this when I talk about this Spinoza fan club and Spinozists, it's not, people don't agree with everything that he said. I don't agree with everything that he said. There's all kinds of, part of being in this Spinoza world is you're in this free thinking world where you don't, you know, you would be insulting his memory to just kind of go along with everything that he said. But part of it is, I think those are the things that were really interesting for me, why I use that that quote from Bertrand Russell, who admires Spinoza, but he disagreed with plenty of what he said, was that it's important, like that the things that he what was really neat about Spinoza was that he was unrelentingly pursuing the truth. And he was unrelentingly pursuing it using reason and empirical evidence. And this is a key thing that I think is really fun for free thinkers. It really, I think, is really cognitively rehabilitating, intellectually rehabilitating, is to realize, well, you can get a buzz in life out of validating your biases. All right. That's what a lot of people do. They have a certain bias, they have a certain feeling, and they look for things that validate that, and they get a little buzz. But for a guy like Spinoza, man, you're missing the whole game of what's really fun about life. Okay. What's really fun about life is, and this is, for Spinoza's idea of what got him into so much trouble was that his idea of God was nature, was everything, was this entire substance. And the way that you would really gain more joy and more power was to connect with more of what is. This is why Albert Einstein loved Spinoza. He would say that Spinoza's God is my God, because Einstein would say things like, I want to know God's thoughts. E = mc squared. That's God's thoughts. So everything, nature, plants, you're for Spinoza, people are aspects of God, your mind, your body, plants, the laws of nature, everything. And the more that you get to know a truth, whether it's a psychological truth, a truth in physics, or whatever, you've embraced more of what is, and you naturally are going to get more joy and more power. And when you understand this kind of Spinoza idea, you're liberated from the little buzzes of just validating your bias, and you could have more fun dialogue internally and more fun conversations with other people.
Well, let's talk a little bit more about etiology, the etiology of these conditions. And I'm aware that when we begin to talk about the possible causes of these disorders, we're kind of implying that there is legitimacy to these disorders, which is already, and it's an assumption that I don't think either of us actually embrace. So that gets very tricky. Like, one of the things, I did a dissertation and I ended up looking into schizophrenia very closely and how it has evolved throughout the editions of the DSM, and interviewed people who had schizophrenia. And one of the things I came away with realizing was just how much diversity there is within the population of people who have been diagnosed with schizophrenia. To think that there would be one cause, or even a set of causes that applies to all of these very different cases who are all under the same label, is simply erroneous. Because, when you look at the criteria for any condition, there's always a variety of things, and people have to meet, some minimum number of, let's say, 8 criteria. They'll have to meet 3 or 4 of them, right? And so given that makes room for so much heterogeneity among people with the same exact condition, which makes it almost impossible to ever find a cause of that condition, or again, a set of consistent contributing factors. So I say that as a qualifier as we enter the territory now of discussing etiology. We know that it's not a chemical imbalance. That is not to be taken seriously anymore. As Peter Gutsch said on this podcast, that theory is stone dead. And unfortunately, that has not been made public enough. So we're doing our part right now to make that public. But I think the common person who doesn't study this stuff has heard of the chemical imbalance theory and takes it for granted. So, we know that's not a legitimate etiological explanation of any of these conditions. But I want to know your thoughts on what you think some of the contributing factors are, some of the potential causes are for people's emotional struggles and for these conditions that get diagnosed as.
Well, I think one of the maybe easier areas for us to talk about in 5 or 10 minutes here, that people are very much familiar with, these attention deficit hyperactivity disorder and this or these so-called disruptive disorders of childhood, this oppositional defiant disorder symptoms, often argue with adults, often refuse to comply with adults. The ADHD, kids not paying attention, hyperactive, impulsive, etc. So people are real familiar with that. And just again, forget about psychiatry, for example. Just think about these behaviors and just think about like what are the kind of what should be, I was to say common sense, but it's not so common anymore, but just logical reasons why a young person might move into being disruptive, being attentionally non-compliant, being behaviorally non-compliant. I can rattle off many, okay, and I'll just throw off a few. One is a feeling of powerlessness. Okay, so if you feel power, now some people, some human beings are more in tune, more sensitive to a need for power than others. So there's certainly some kids could stay seated in a classroom and in a family and have no power, and they're not going to wig out. It's not that big a deal for them for whatever reason. But for a lot of human beings, the sense of having zero power over your life is an incredibly uncomfortable feeling. So powerlessness. Boredom is another reason why. Now, people hear young kids say over and over again, I'm bored, and they don't take it seriously. I do. I remember how boring it was to be in most of my classrooms. And again, for a lot of kids, that feeling of boredom is intolerable. For some folks, a lot of these folks end up becoming teachers or shrinks or something like that. They can handle boredom real well. I don't know, so they don't realize, they don't call that an illness, the fact that they can handle boredom too well. But for a lot of other folks, they can't. And I don't see that as a disease that you can't handle boredom. It's just, and another reasons why that people, for a lot of people, that they are behaving disruptively because they have resentment. They have a sense of injustice. Something went on that they feel is unfair. So we could go on. Obviously, other obvious things. People didn't have enough sleep. They didn't have, they're not getting enough sleep. So many of these kids are getting diagnosed with ADHD, are getting not enough sleep. They're not eating the way they should be eating. They're not exercising. There's some really obvious stuff that causes it. A lot of other reasons that they're feeling maybe some trauma in their life. Maybe they had their parents are going through a horrible divorce, and that overwhelming pain is so dominating their brain that they can't pay attention to anything. So we could go on and on and on. I've given you 4 or 5. I'm sure we could come up with 10 at least between the two of us. But I think the important thing is when you stop looking at these behaviors that create tension as diseases, you stop medicalizing them, diseasing them, pathologizing them, and you start using your critical thinking, using your brain to try to understand, then you're going to really be helpful. Because you think about it for yourself, Nick, I know for myself, is like if I was doing some stuff that was creating tension, whether it was being depressed, not paying attention, acting crazy, what would we want? We'd want somebody who was curious, right? We'd want compassion. We'd want curiosity. We'd want somebody who wasn't sitting around trying to figure out whether this guy's bipolar disorder, they're schizophrenic, they're schizoaffective. Who the hell would want something like that? We'd want somebody trying to figure out why the hell are you being that way and having some compassion for us. And that would be key. And that just doesn't go on. We know that doesn't go on in mental health, but it certainly doesn't go on in psychiatry. 95% of these guys are just doing these medical managements. They're just checking people's symptoms and tweaking their medication. And unfortunately, there used to be a bigger divide among clinical psychologists and psychiatrists, but unfortunately, that gap is closed a lot, and they don't think as differently as psychiatry anymore. So that's sad for me, because once upon a time, psychologists, this wasn't as radical. The stuff that I was talking about right now, it wasn't anywhere near as radical as it may sound today.
Excellent answer. Honestly, it's beautiful, beautiful. And it's just, it never ceases to astonish me when I hear stories so often of people who go see a psychiatrist and are diagnosed with a disorder within 10 minutes, 15 minutes, 20 minutes, one short questionnaire, and also are given a prescription in that amount of time, and are made to believe that they need to be on this drug for the rest of their life. And it sounds so absurd. It would be like, you would think it would be impossible for any professional to actually practice in this way, but it's rampant.
Right. You and I know this is routine. It sounds like outrageous, but it's routine. And I think one of the things that I really want to I've spent a lifetime trying to inoculate people, so vaccinate here, from the idea that this is what happens to people, parents who are, or even parents who are ordinarily intelligent, critically thinking people, when they get scared. And this is an important lesson from Spinoza, that I have a whole chapter in the book on fear. Fear makes us irrational. It makes us buy into superstitions, buy into illegitimate authorities, buy into demagogues. Okay, this is what fear does. And so a real good helper, whatever they're trying to help you with, but certainly a mental health professional, job number one is trying to reduce everybody's fear. Because if you can reduce everybody's fear, okay, of the situation, of the phenomenon, what's going on, everybody just axiomatically, naturally, we're going to think better. You and I, if you get us scared enough, we're more vulnerable to some simple, simple explanation, some authority who looks like they know what they're talking about. And unfortunately, you've hung around these people, as have I. A lot of these people actually know nothing, but they're very good at looking like they know what they're talking about. I can see you've seen that, and when they can't fool people who aren't afraid. But if you're scared enough and somebody puts on a good act like they know what they're talking about, you're vulnerable to that. And so part of what I try to help people with is to try to not be afraid of all of these different conditions, not have so much tension about it. And then you'll be able to be in touch with your intuition. Your intuition, for example, is like that. A lot of people I've talked to, they say, my intuition told me this person was not a great therapist or great psychiatrist, and they didn't care. They were just out for money. But I was so scared, I didn't go with my intuition, with what my gut was telling me. And so that your fear blocks your thinking. It also blocks your gut feelings, which are often correct. And so that's a big part of what you want to do to kind of help just your friends, help yourself, help one another out there. And that's certainly what professionals should be doing. And unfortunately, as you well know, they're not. Sometimes they're escalating, they're inflaming fears.
Right. I had a story. I interviewed one of my participants in my dissertation study was a young man who had schizophrenia, and he was telling me about his meetings with his psychiatrist and how he would get really nervous in this man's presence. Understandably, because it's there's this power dynamic, there's the authority in the room, and then the sterile environment. He had just been institutionalized involuntarily. And he was talking about how the psychiatrist would escalate that fear, like you said, and he would repeat things like, "You're not well, you're not well." And it was like gaslighting this young man. It was making him believe that he was dissociated from reality and mentally ill. And fortunately, that man's story took a very positive turn, and he ended up, being able to come off of his drugs and no longer, was subject to psychiatric treatment. I'll mention this too, because I know we don't have that much more time, but one of the kind of mind-blowing things from your book was what you talked about related to the movie A Beautiful Mind and the story of John Nash, because that was always one of my favorite movies. So I'm 36 now. And so when that movie came out, I was like maybe 14, 15 years old. And that was actually one of the first movies that made me realize I loved psychology with all my heart. And it was fascinating to me, A Beautiful Mind. And in that movie, as you talk about, there is a line where it's something to the effect of someone asking John Nash like how he recovered. And in the movie, he says something like, "I started taking the newer meds." But the truth of John Nash was that he stopped taking the meds. And that was crucial for his recovery, according to himself. And I just thought, wow, this is just such a concrete example of perpetuating the narrative along in the culture that, you better not come off your meds. You need to be on them for the rest of your life. And I understood, like you said, one of the, I guess, movie producers' moms was a psychologist who suggested that if they told the truth in the movie that he came off of his meds, then you would have people suddenly coming off their meds, and that could be problematic. And perhaps that was why they basically lied in the movie. But I just wanted to bring that up and appreciate and thank you for adding that into this book, because it blew my mind. It was just such a perfect.
Right. I think people again have to understand how powerful politics is. And, the people who were making that movie, Ron Howard and the screenwriter whose parent was a psychologist, they well understood the politics, and they understood what was really interesting for me. They could have just left out that whole scene. They could have just said, avoided the whole reality that John Nash, actually got his act together, without the help. Him and his family, as I go into the book, his wife really thought that the psychiatric hospitalizations made things worse, that they really had a negative feeling about psychiatric treatment, which you don't get from that movie at all. You get it from the book, by the way. If you read the book, Sylvia Nasser's book On a Beautiful Mind, this is all in there, but not in the movie. And it was clear to those guys who were making the movie that the psychiatry, the pharmaceutical and psychiatric industrial complex, the media that they control through their advertising dollars, they had so much power that for them to be in any way casting aspersions on psychiatry, that this movie may not even get made, or if it would get made, politically, it wasn't going to win any Oscar, okay, which is what it did. And so, but what's interesting for me was not only, I thought like, well, just leave it out. Why do you have to lie? Just leave out the fact that he stopped taking the medication. But they actually had to insert basically a product placement for drugs, where you have Nash saying, I take the newer medication. And I thought, wow, that would be appalling for a guy like Spinoza, who I was actually, all of these things I was trying to look at through the lens of Spinoza. Now, wow, what power. This is like the same kind of power that the clergy had in his day, that they have the power to like fabricate and make up, lies about reality. And and Nash, you could go on YouTube videos and find interviews with him. It's not only in the book, and he's pretty cool about it. He doesn't flip out about it. He says it's just not true, that he went off and what's really also sad too, as I make clear in the book, was not only is that lie sad, but what's missing is what's really fascinating is how Nash did get his act together. How he did move from really being quite, having these bizarre beliefs, believing like this, he was sent by the CIA here, or, that he was sent by extraterrestrials to save America, and on and on. And how did he move out of these delusions into having a good life? And I think that's incredibly valuable for people who are going through these episodes, how he actually got into this thing, which I talk about, how he got into that head and how he came out of it. And so, that movie and psychiatry in general just deprives people of some, not only truths, but some really fascinating, fun stuff to think about.
What's your short summary of how he did, in fact, recover?
Well, what Nash says, a couple of things. Nash says is that he realized that it was almost impossible for him to get rid of these voices or these delusions. And he uses the analogy, like he treated them like dieting. Like he treated these things like they were just like bad calories, and he wasn't going to take them seriously. And he was just like, if he had these strange ideas go through his head, he wasn't going to be controlled by them. And he also came to the conclusion that he went too deep into the rabbit hole of politics, and that's what made him crazy. And that he got back into doing math. He's one of the earliest computer users. Some friends gave him a computer, and he started to really delve into that. The other hugely satisfying thing, and they were somewhat accurate in the movie about this, was incredibly helpful for him, was that he was lucky enough to, when he was still kind of a little bit bizarre and crazy, to be in that Princeton academic community where he had a lot of supportive relationships, where his eccentricity wasn't viewed as so crazy. I mean, back not that many years before, you had Einstein walking around campus, talking to himself, and like, you can be a little bit more bizarre as a mathematician and a physicist in that kind of world. And so he had people didn't give up on him. His wife didn't give up on him. So that part of the movie was accurate. The fact that he did that, the support was incredibly helpful. But there's interesting that what they didn't talk about was the other interesting cognitive things that he did. And what they did talk about, which was completely unhelpful, was all kind of psychiatric treatment, including the medication. By the way, one of the things that is in the book that people could find, that his sister, they were told he should get electroshock, and his sister and wife said, no, that's going to ruin his brain, and he'll never be able to recover, because that's the most important, valuable thing for him, his ability to think. And they were proud of themselves that they fought off the electroshock, because once he moved into a state of recovery, he could still think pretty clearly. And they weren't going to put that in any movie.
Right. It's shocking to me that electroshock treatment is still used and justified. You can go on YouTube right now and just, look at various clinics and listen to doctors justify the use of that treatment. It's kind of unbelievable. But listen, I know I don't know how long you expected this would go, but I want to be mindful of your time, and you've given me an hour and 20 minutes of your time already. Bruce, would you be open to eventually doing a part 2 conversation?
Sure. Okay. This is fun, Nick. Sure.
Yeah,
absolutely.
This is fun. And I just, I appreciate your perspective so much. Like I said, I've spoken to many experts now, and I've read, many different books and articles on this topic, but you bring a very unique, fresh take on it. And your book especially is quite creative with the way you look through the lens of a famous free thinker. So I loved it. I was inspired by it. I highly recommend it to anyone who's listening. Again, the title of it is A Profession Without Reason, The Crisis of Contemporary Psychiatry, Untangled and Solved by Spinoza, Freethinking, and Radical Enlightenment. So yeah, I will touch base with you soon, Bruce. I thank you so much for sharing your expertise with all of us here at the Psychology is podcast. And I hope you have a wonderful evening.
Thank you, Nick. My pleasure talking to you, and I'm sure we'll talk again.
Yes.